Hello everyone, this is Bob Browner with Community Coronavirus Update number 74. Today we'll talk about some promising trends and will we reach herd immunity, whatever that is. And the real answer, of course, maybe, but not without schools, which we'll talk about as well. So some good things that have happened. One thing that I'm really excited about is that Pfizer might be approved as early as next week for 12 to 15-year-olds. And so getting to herd immunity and getting back to normal is really going to require us vaccinating kids in schools. And so this opens up the real possibility that we could be starting middle and high school in the fall with no mask, for example. So it's really exciting that this is going to be available because we can't get to herd immunity without vaccinating the kids. Other thing is we're seeing what normal looks like and who's done it. And so Israel lately is pretty much returning to normal. They've vaccinated enough people, their rates have dropped low enough. The key, of course, is this number, and people keep forgetting to look at the actual numbers and rather than just relying on, ideology and wishful thinking. Israel to get where it got is at a range of zero point 0.8 per 100,000. So this is a key number to remember. This is what returning to normal means, is getting down to that number. United Kingdom is also getting close. They're down to 3.3 per 100,000, so a huge drop for them as well. They had similar big outbreaks just like us in Israel. But keep in mind, United States, yes, we've made some improvement. We're still up at 15 per 100,000. So our rates are more than 15 times what Israel is right there. So although we're making progress, we're not quite there yet. And my biggest worry is we're going to give up too soon, like we've done over and over again for the last year and a half. And so the key is we got to maintain what we're doing and not give up too soon. And so, if we were on track like UK or Israel, you'd see most of this map either yellow or green, not orange or red like we are right now. So, like I said, we're not there yet. Another more granular view is like this, and yes, although there is some green here, it needs to be broad swaths of green, because if you're in this green county, the county next to you still has a bit of spread, and people move around a bit. So you need to see much broader areas of yellow and green before we're ready to give up wearing masks and things. And one of the problems people forget is that if let's say your school gives us wearing masks today, you're not going to see the results of that mistake in a week. It'll take about 6 to 8 weeks to see what that mistake looks like. And so it's going to you have to know kind of what the numbers are and what the time frame for the response to the numbers would be. The good news here, at least in Lincoln, is that we have a good trend. So we are finally, after 2 months of hovering and sort of being at a stalemate, we actually are now seeing a drop. So I think we're getting to the point where our vaccination rate, plus what we're currently doing with our mask ordinance, is finally working. Same with the rest of the state, where we're seeing again, they had that bump in cases over the Easter weekend, again dropping here below 10 per 100,000, which is great progress, but still not down to the UK and Israel level quite yet. And if you look across the state, yes, we have even at the Panhandle, which has the lowest rate as of today, it's still above what UK and Israel has, and so still we're not quite there. We're getting close. Let's just make it through the last couple of weeks of schools and not start taking everybody's masks off, so we can maintain this and get to the point where Israel's at. Um, because then we know what getting it wrong looks like. And so a couple articles about both India and Brazil. Brazil was probably the poster child of totally getting it wrong, thinking they were at herd immunity with natural infection, which doesn't work. And essentially, the previous versions of coronavirus, a lot of people seem to lose immunity about 6 to 8 months later to the new variants, and that's why Brazil really took off, as well as India. And then looking at the numbers, basically the ultimate end result of did you do it right or not is your dead not dead list. And so the numbers, Brazil actually has now blown past both the United States and the United Kingdom on the number of fatalities they've had. They probably will catch up and even pass Belgium pretty soon. So Brazil is the poster child of getting it wrong. And this data is probably underreported. A lot of people aren't trusting the mortality statistics with the Bolsonaro in charge. And so, getting it wrong versus getting it right, this is what the number tells you who got it wrong and who got it right. And again, looking at our numbers, although we've done bad, we haven't done as bad as some others, but we could have done much better. If we were Brazil, we'd had another 75,000 dead people. But if Germany, we'd have half the number of dead people we have. But if we were Norway or Japan, we'd have a 500,000 fewer dead people if we'd have done as well as Norway or Japan. And so at the end of the day, you really got to go by the numbers. You don't just get to make up whether you won or lost, just like a football game. At the end of the day, it's either a W or an L. And this gives us some idea of an objective way to say who's got it right and who's got it wrong. So will we reach herd immunity? And so you're probably hearing a lot of this debate about whether we can or can't. I think we can, meaning scientifically and public health wise, we know how to get to herd immunity. Whether we'll do it or not is really more of a political dilemma, not a scientific dilemma. We know how to get to herd immunity, and I think we can do it. I just don't know if we can do it politically. Part of the problem is that public health is not run at the national level in the United States. So yes, the CDC is putting out better data, better recommendations right now, but the CDC does not run public health. Most of public health is done at either the local or the state level, depending on the state and what the laws say. And so it's up to the states and the local health departments and the communities to actually make this happen. And can we get enough cohesive management where people will actually look at the evidence and make decisions based on good science? Or will we make all their decisions based on ideology and wishful thinking? And I think you'll probably see a mixed bag. And I think that's why a lot of experts are starting to get skeptical about whether we'll get there. We may still see outbreaks for a long time to come until people finally get to understanding the science behind all this. Now that doesn't mean we weren't going to return to closer to normal. And so here's a good article about Vox where they talk about this, that I think we well, we already are getting closer to normal, but we're not normal yet. One thing that they did cover pretty well, I think, in this Vox article is Israel didn't give up. They still have some precautions in place. Even though their rates are 15 times lower than us, they still have some masking requirements. They still have some capacity requirements. They also have green passes where you have to either have a vaccine or a negative test. And so they are still putting in public health efforts, even though their numbers are that good and their vaccination rates that good. So this can't be a one-pronged strategy. It can't be a vaccination-only strategy to work. And we need to look at what the Israelis have done and not forget what those lessons are telling us. And so, one of the problems that I think there's a lot of misunderstanding about what R, or inherent infectiousness, or R naught, and herd immunity really are. There's a good article about in Nature where they kind of talk about some of this, where there's been a lot of sort of communication about what this really means. And so even I've seen this on Facebook where people said, well, I thought the goal was 75%. Wouldn't that get us there? Well, the answer is it's a little more complicated than just a static number. And the reason is this is a multivariable equation. It's dependent on a couple different things, and all of these things can change the actual number, whether it's 75%, 80%, 60%. And so here's the things that go into that variable equation. One is the inherent infectiousness of the virus, which is sometimes called R naught. Most people thought the original version of coronavirus was in the 2.5 to 3.5 range. However, with the new variants, it might be higher, more like 4.5. 12 is the generally accepted infectiousness of measles by comparison. And so with measles, because we have a highly effective vaccine against measles and a high vaccination rate, we're mostly at herd immunity with measles, and so we don't see many measles outbreaks, although we do see some, which I'll talk about in a minute. But it's partially dependent also on vaccine efficacy. So you have a 95% effective vaccine, we would need 82%, for example, if we have an infectious variant like this. But if it's an 80% effective vaccine, we actually hit to 97%, which we probably won't get to. So this is why we might not get to herd immunity. However, this is not the all the story. There's R naught, which is the inherent infectiousness. There's also the effective infectiousness of the virus in a community given what you're currently doing. So some things to keep in mind is, one, we are seeing a lot more of the B117 variant first found in UK. Right now, Nebraska, 45% of the cases are B117. So we have that more infectious variant. So we need to probably be thinking in terms of that R naught of 4.5. However, there's things we can do to lower the effective transmission of the virus. So maybe we're dealing with a 4.5 R naught virus with B117, but we can convert the effective transmission down to a lower number by doing things like, for example, having masks in schools, limiting capacity, maintaining some distance. And so the amount it would take to stop all spread in a community can be lowered if we don't give up. So the Israelis have kept things in place. They're not just saying everybody take your masks off right now. They want to get to the lower point so they can drive spread to almost zero, because then that will make a bigger difference. And so we need to keep our other interventions in place and not go giving up on them. Another interesting article, so there's this article about the cruise ships, and then the CDC saying, wait, 95% and 98%. Well, why are they saying this very, very high number? Well, it's because there are some situations that go the other direction. So there are areas that are perfectly set up for a respiratory virus to spread. One of those is in a ship with thousands of people. And so in a cruise ship, it's going to be even more important that enough people are vaccinated effectively to be safe. And so I would not be surprised if cruise ships do require you to provide some proof of immunity before before you get on them. And I think if we did this, yeah, cruise ships would be safe again. It's no accident that we learned a lot from the cruise ships. You may remember the Diamond Princess line, but actually some of our evidence also came from some Navy ships. So in the past, we've talked about this CDC analysis of the USS Theodore Roosevelt, which had an outbreak, and 60% of the sailors got coronavirus in that ship. Well, that's how we learn what really worked or not, because they did a great analysis of that, and what they found is that the people who were wearing masks were much less likely to get infected. The people who avoided common areas were much less likely to get infected, and the people who were social distancing were much more likely to get less likely to get infected. And that's some of the early data that showed us what really works and stopped this pandemic came from the USS Teddy Roosevelt and studying other areas like this. So yes, masks work. Yes, avoiding common areas work, and yes, social distancing does actually work. So we need to not forget those lessons. The other problem right now, we're making a ton of progress with getting people vaccinated. However, unfortunately, now we're seeing that we're getting to the harder part. Getting the first 40% of people vaccinated was the easy part. Getting the second 40% is going to be the hard part. And so you'll see these trajectories changing based on our current vaccination rate. We need to get this back up again, and we really need to get toward probably 70, 80, 90% of people vaccinated. That also includes not just adults, but we also have to vaccinate children. And so what some people are missing is the state numbers are calculated not including children. So this 45% or even 47% in Lancaster County, that's not all of the county, that's only the county above 16. To get us fully under control, we also have to get the kids under 16, but of course that means we have to have a vaccine we can give to kids under 16. That's why the Pfizer article is so important. The other thing to keep in mind from a school standpoint is schools are essential to controlling infectious diseases in a community. And the reason for that is how connected the school is to the entire community. And so this article I've used in the past from Health Affairs talking about the risk of COVID from schools, the reason schools are so important is that literally 35% of adults in a community are directly contacted with the school because they either work at the school, or married to someone who works at the school, or have a child who works at the school. So any spread within a school makes a huge impact on the community, and that's why it's really important for us to get the school right. That's why schools are the place where we've most enforced vaccination requirements in the past few decades. That's how schools were a critical part of getting rid of polio and measles and rubella and mumps and all those infections. And so we're going to have to get schools right this fall. We've got a few weeks and schools will be out of session, but when we bring them back in fall and August, we are going to need to be very, very careful about how we get the schools started. I think there's a chance that we could start schools without masks if we get a sufficient vaccination rate, but we may still have to have kids wearing masks at different times in schools depending on community spread and vaccination rate. So keep that in mind. So, but despite that, life is going to start getting more and more to normal, and already is, which is great. So, for example, I think it was great when the CDC said, if you're outdoors, there's a much lower risk. You may not need a mask. We may also need to call this something different than herd immunity. We may have to call it population or community immunity or something else to get people to get out of that baggage of herd immunity. So get out and get and there are places where you don't need a mask. So this is me at the farmer's market on Saturday. We went on a bike ride, swung by the farmer's market because I like having the breakfast burritos at the shack. You'll see me, I was not wearing a mask. Why? Because one, I've been vaccinated. Two, it's outdoors. And three, there's enough space here that I was comfortable with it. Had it been much more crowded, I might have put a mask back on. So there are times where you may need a mask, like if you're at a Husker football and everybody's shoulder to shoulder. Until we have a higher vaccination rate, I think you still need a mask actually. But for things like this, you don't need a mask. And I was at a mixer last night. It was in somebody's garage. The doors are open. I know that the group, most of us were vaccinated. So yeah, we didn't wear a mask because I think in this situation, you don't need a mask. So the question is, make a good judgment based on your individual risks. I keep going back to this over and over again. Unfortunately, that is a multivariable equation, and so use these things to sort of quantify your own risk based on your own on health conditions, and hopefully that'll help you. So hopefully this is another helpful update to you. Again, a reminder, disclaimer, these are my opinions, not necessarily all the people I work with and for, and the old episodes are on healthylincoln.org if you're interested, and hope this helps.